If I were to describe Dr. Hector Flores to someone who had not met him, I would say this is a kind, brilliant, thoughtful, sensitive, and compassionate physician, and one of the best I know.
Whenever I've been in a room and I've looked around and seen his face, I feel better.
Yes, Dr. Hector Flores is one of these people who knows no cultural, racial boundary. He has been this person who has just really done a tremendous job, I think, of bridging the Black and brown community in times of scarcity and struggle.
He's been a role model for residents. Starting his residency program, which focuses on underserved communities.
Dr. Hector Flores has done a terrific job of providing leadership at White Memorial Medical Center, and he's transformed that program from a program that was not highly regarded nationally into one that has achieved a national reputation for excellence in the training of medical residents.
I've learned from Dr. Flores that even in very tense and heated situations, logic and true passion will prevail.
He's also been an important leader in making certain that communities are represented at the table of healthcare decisions. Communities that don't have a lot of voice, who are typically not well represented. When Dr. Hector Flores is in the room, you know that the needs of underserved communities are going to be very well represented.
I think the motivation for me to sort of become an activist and advocate for the community beyond my medical practice is, I think a lot of credit goes to my parents. My parents' story is a classic immigrant story. They rolled the dice to come to the United States, looking not so much for a better life for themselves, but for their kids, and there are 6 of us. And I know that we achieved a lot of opportunities because of being in the U.S. and the motivation that they gave us. And one thing that they always taught us was never to forget those that are less fortunate than we are. And that always impressed me, that I needed to do that as a sort of respect for their wishes and their advice and guidance.
Well, I think what Dr. Hector Flores has meant for the broader community of Los Angeles is a consistent, powerful voice and action to follow that voice, to make certain that underserved communities will be served, and that they can be served not with second-rate care, but with high-quality, first-class, excellent care. And that's what Dr. Flores has meant for the community of Los Angeles and beyond.
Every day I've worked with others who are like-minded to try to improve conditions in the community that we serve. I tell my family that I enjoy my job because I work with people I like. I work with people that have similar ideals. And the main thing really is knowing that we can reach out and help others just the way others reached out to help us.
Dr. Flores embodies what I would call servant leadership. He leads by doing. What he does is he does represent and can represent a voice at the policy table in healthcare discussions around the needs of the underserved, but he also backs that up by walking the talk. He sees patients, he trains medical residents and physicians, he makes sure that he's putting his body on the line for the needs of these underserved communities.
Many times we get frustrated because we think patients don't want to participate in their care. The real reason is we haven't figured out how to engage with them as partners, and we tend to try to fit our model into them rather than saying, teach me how I can be a better doctor to you.
He's a great guy. We need to produce more people like Dr. Flores. Hopefully that will be my legacy, that one day I'll be able to look up and say that we've created dozens and dozens of Hector Flores. And if we do that, we will change the world.